America was first infected by the coronavirus months ago. We've been trying to play catch-up ever since. Our cover story is reported by Martha Teichner.
At 4 o'clock in the morning on Thursday, January 9th.
Justin Bieber revealed that he's been battling Lyme disease.
Taking second billing to Justin Bieber's big revelation.
He says that he's getting treatment.
Coronavirus got its first mention on a CBS News broadcast.
Scientists say a new virus related to SARS may be responsible for a mysterious pneumonia outbreak in China.
The New York Times beat us with its first coverage January 7th on page 13. By then, Chinese public health officials had already notified CDC Director Robert Redfield about the virus. Redfield had immediately briefed Health and Human Services Secretary Alex Azar, who in turn alerted the National Security Council. So how did we get from those small but worrying early warnings out of Wuhan, China, to now, to leading the world, not in managing the crisis, but in confirmed coronavirus cases and deaths? To untangle what went wrong, start with a nod to Watergate.
What did the president know?
Thank you very much, everyone.
And when did his White House know it?
We now know that Xi Jinping went before the State Council, the high governing body of China, and told them in a secret session on January 7th that the issue in Wuhan was so serious that he was personally stepping in and taking control.
Laurie Garrett is a Pulitzer Prize-winning science writer and author of The Coming Plague.
The head of state of a nation of more than 1 billion people doesn't personally intervene in a little outbreak with a half a dozen cases. We now know that the CIA was passing on to the White House, look, there's something potentially catastrophic emerging.
Breaking news on January 17th.
Mystery illness.
The first U.S. attempt to shut the door on the virus.
So they are screening passengers arriving from central China.
But 4 days later, on January 21st, the CDC reported the first case of Covid-19 here.
This is certainly not a moment for panic or high anxiety. It is a moment for vigilance.
Interviewed at the World Economic Forum in Davos, Switzerland, President Trump reacted this way.
We have it totally under control. It's one person coming in from China.
But events indicated otherwise.
I'm declaring a public health emergency of...
On January 30th, the World Health Organization declared a global public health emergency.
Outside of Chicago, there are new fears.
And the first known case of person-to-person transmission of COVID-19 in the United States was announced.
There are nearly 100 other Americans now being tested.
Foreign nationals, other than immediate family of U.S. citizens and permanent residents.
The following day, the Trump administration restricted travel from China.
Will be denied entry into the United States for this time.
But not from Europe. That wouldn't happen for more than a month, although Europe was the source of many U.S. infections, we know now. But the China travel ban may have bought a little time.
My expectation, and I have to say in retrospect is quite wrong, was that there was massive planning happening in the U.S. government.
Dr. Ashish Jha is head of the Harvard Global Health Institute.
I assume there was a lot of ramping up of testing and getting our country ready for what was coming.
But?
Well, it's really become clear now that there was not.
The fact that the CDC's test kits didn't work meant that coronavirus was out there, spreading, and no one knew where.
Experts worry it could become a pandemic.
What came next? 6 weeks of schizophrenia.
A lot of people think that goes away in April with the heat.
Dueling versions of reality.
Coronavirus outbreak took a very frightening turn overnight.
We have it very much under control.
But the nation was preoccupied not with coronavirus, but with impeachment.
Witch hunt that's been going on for years.
Good to see you. How are you?
And the primaries.
Welcome to the campaign trail, Nora.
I think it was only at the end of February, early March, that it started dawning on us that, my God, we wasted 6 weeks of early warning time.
Here's my pile of U.S. government pandemic preparedness plans. On top, November 2005.
It wasn't as if there was no roadmap.
Structural issues. Who's in charge of what? What's the CDC's role versus the state health role? These are all in every single one of these plans. And they've all been debated by very wise people in governments, both Republican and Democrat.
And set aside, just as the Trump administration set aside the so-called playbook handed them by the Obama transition team.
I was one of the people who oversaw the development of the playbook.
Until March 2017, Beth Cameron headed the office responsible for pandemic preparedness within the National Security Council.
Our job was to coordinate policy and to work with departments and agencies to make sure that we had the programs in place to prepare for the next pandemic and to be more agile in responding.
She said was, because the office was eliminated in May 2018. Gone, what Cameron describes in a Washington Post op-ed as the ability to get ahead of emergencies.
So if our office had still existed, one of the key jobs would have been to make sure that we understood what was happening with the Strategic National Stockpile.
We didn't have tests. We had no ready supplies of any equipment that could determine who was infected and who wasn't.
In the May issue of the New Republic, Laurie Garrett is scathing, blaming Donald Trump, but also Xi Jinping.
Both of these men have screwed up everything that was possible for them to screw up.
Certainly, I think China's lying made our response harder. I think our federal government's response, it was one failure after another after another.
According to Ashish Jha, it didn't have to come to this.
The total shutdown that we have experienced in our country, I don't believe that was necessary if we had done our job right in January and February. We were asleep at the wheel for so long that by the time March arrived, we really had no other choice but to shut the country down.
It's going to disappear. One day it's like a miracle. It will disappear.
When the president said that on February 27th, the financial markets were tanking, and the known number of COVID-19 deaths began to ratchet up.
Amen. Amen.
The miracle the president predicted hasn't happened yet.
To unleash the full power of the federal government.
On March 13th, President Trump declared a national emergency.
Two very big words.
On March 31st, he predicted
this could be a hell of a bad 2 weeks.
At the end of those 2 weeks, on April 13th, he patted himself on the back.
All of the things we've done, nobody's ever done a job like this.
This past Friday, COVID-19 deaths in the United States passed 50,000.